A very good afternoon to you, ladies and gentlemen of the media. Thanks for coming once again. And good afternoon to our viewers and listeners all. Today, Friday, at the end of another week, I'm here to give you a little update. I have with me my colleagues in the relevant ministries, and we have our technical people who will bring you up to date. I simply want to begin by once again thanking the national community for being largely cooperative, and to emphasize and re-emphasize that we are still in a very fluid and dangerous situation. We are managing as best we can a challenge which we have been surprised by largely. It's only a couple of months old now, or 3 months old, and we have been called upon to watch it come to us from afar, and it's now within our borders. The Minister of Health will give you the health update with respect to how the ministry and its agencies are functioning, and the regional response, which is based here in Trinidad and Tobago and so on. And the Minister of National Security will tell you about what we have been doing in that area. I just want to mention that over and above our apparent 100% focus on this matter, it should not be forgotten that additional to this, the normal way of life has been going on. People have been going to work, people have been trying to produce, and we are still involved in local and international trade. I want once again to encourage those first responders, and I speak here specifically of our healthcare givers, those who are responsible for keeping the hospitals working, the technical staff, the support staff, the ward attendants, the maintenance people, the security people, the nurses, the doctors, and our suppliers. This is the body of people who are out there ensuring that our singular tool to respond to this challenge, our health sector, that is functioning and functioning well. And I'm very pleased to inform the national community that by and large, we have nothing but good reports from this sector. I also want to thank the members of the security services, the police service, the defense force, the customs, and all these people who are at work keeping our borders open to allow essentials to come in, to prevent non-essentials from coming in, and also managing in a very strict way persons who come to us, and of course what happens to us in that way. And to thank all the aspects of national life which keep us having a semi-normal day while we are focusing in the most serious and conscientious way in responding at the personal level to the COVID-19 challenge. Because at the end of the day, I want to re-emphasize that the real response is personal. Personal hygiene. It is what you do. It is how you carry out the protocols. It is how you stay away from people as far as you are able to. It is how you carry out the instructions of staying home if you have to. If you are sick, then you stay away because you don't want to infect anybody. And by away, we mean in the home, outside the home. If you have to come out, as many of us have to come out, then you do what we did in the Parliament this morning. We conduct our business in a slightly modified way by putting that distance between persons to minimize the transmission of the virus from one person to another. These are the things that matter. Personal behavior. Of course, there are a few persons who believe that these entreaties don't apply to them. And of course, some people go as far as to talk about their rights. Well, yesterday morning I was very sobered. I saw a television clip which really shook me in northern Italy, an area that I know fairly well, to see the Italian army going into towns to remove bodies and coffins, helping the local community, because they have been overcome by the numbers. So those who think that this is a joke, have a look at that situation and imagine if that was your location, what you're dealing with. What we are doing here, as I said earlier on, we are taking some actions which are very clearly going to affect persons at the individual level and at the national level negatively. We know that. But those are the actions that we have to take. And as we take them, we try as far as we are able to cushion the effects. But we can't insulate you from those effects. And we also said that the burden would be carried by the government, acting as trustees for the resources of the population, by the business sector, by the labor movement, and by the individuals of the nation. Those four sections have to work together successfully to ensure that we have a successful outcome. We go in with this issue. We don't know when it's going to end. We may have to make changes along the way depending on what is happening. So we are monitoring this on an hourly basis. So you will see changes. And the one thing that is going to make it more difficult for us is the unnecessary and unwanted misinformation that some people seem to insist on putting in the system. But as far as we are able to, we will want to try to ensure that you get, for the population, correct and accurate information which you can trust. And those persons who believe that they can do as they please to the detriment of others, today we have gone to the Parliament and we have gone beyond the suasion and put some legal authority in the hands of our officers of state to ensure that persons at the minority level do not put the majority in any peril because of their irresponsible or miserable conduct. So we've done that, and we've had a short session of Parliament this morning, and we passed a number of amendments to existing laws to give authority to enforce certain kinds of behavior. And of course, we have to go back to the Parliament in a few days' time to give us legal authority to use some of the resources that we have available from the Stabilization Fund. So that is what we're seeing. And the Minister of Finance will talk to you about that at a later stage. But today I want to allow the Minister of Health and his staff to bring us up to date on what we've been experiencing in the last 24 hours.
Thank you very much, Prime Minister. Good afternoon, ladies and gentlemen of the media, and to all those wonderful citizens of Trinidad and Tobago listening in. I want to pick up where the Prime Minister was in thanking most sincerely all healthcare workers. I must let you know I spoke to the CEO of the Eastern RHA this morning, and do you know healthcare workers who are not in the system are actually volunteering to go and look after our citizens in Balandra, and that is to be lauded. So I want to congratulate those volunteers, thank again all healthcare workers who are going above and beyond the call of duty. I just want to touch on a couple of things of a slightly religious nature. If there was a photograph going around of a church service, I believe in central Trinidad yesterday, if that is true, we are asking all leaders of churches, religions, you are not helping the situation. We are asking that no gathering should be more than 10 persons, because a mass gathering like that, according to the picture I saw, is a danger to Trinidad and Tobago. It's an absolute danger. I want to speak directly for a short while to the Hindu community. I've been getting lots of calls from the Hindu community about access to rivers for shaving. You know, in the Hindu religion, when you have a death in the family, you must go to a place with water and do the shaving ritual. We are encouraging people and Hindus to continue with their religious traditions. The only thing we ask is that you limit your party to 10 persons. Heaven knows we need prayer, we need to have a closer alliance with the Creator. So I just want to assure our Hindu brothers and sisters, you can go to the rivers to do your shaving, but just keep it down to 10 people, please. I will now bring you up to date on some of the operational matters that we have put into force over the past 24 to 48 hours to manage this evolving situation, this evolving pandemic of which Trinidad and Tobago is a part. With me, I have Dr. Erica Wheeler, Country Representative for PAHO, Dr. Lisa Indar, Assistant Director of CARFA. I would have met with Dr. Wheeler and had a phone conversation with Dr. Joyce and John, who is the Executive Director of CARFA. She's out of the country, so we spoke by phone. And Dr. Indar will be telling you what we have decided going forward with improving and increasing our testing protocols based on WHO's recommendations. But to do more testing, we are going to need people on the ground. We have operationalized within the past 24 hours the following plan to help us with contact tracing, because what is going to happen sooner or later, we are going to have community cases. So far, all the cases we have had have been imported cases, but there will come a time when you have community spread. To help us with community spread, we need bodies on the ground to do what is called contact tracing, which I think you're all familiar with now. We have now operationalized something that we envisaged. 100 persons will be going on the ground from as early as over the weekend, if need be, to help us with contact tracing. Who are these 100 trained persons? 1, 50 are coming from the Trinidad and Tobago Red Cross Society. And again, I want to thank that organization from coming forward and volunteering. The Prime Minister in 2015 would have called for people to volunteer, volunteerism. They have volunteered 50 trained contact tracers, and they will now be under the management of the Ministry of Health to help with contact tracing, because without proper contact tracing, you will get a lot of community spread. The other 50 come from a program which we launched at the Hilton. Some of you may have been there about a month ago. That is the District Health Visitor Program, where you have 50 registered nurses, already qualified, but in a special program called the District Health Visitor Program, which was something that used to happen decades ago, which we have revived. I have spoken to the University of the West Indies this morning. I want to thank Professor Brian Copeland and Dr. Ocho, who manages UWI School of Nursing, to suspend the academic part of the program and have these 50 registered nurses help us with contact tracing as early as humanly possible. So between the Trinidad Red Cross and the 50 DHVs, we are going to have 100 trained persons on the ground to help us manage this evolving situation. In line with the new protocols for testing, which Dr. Lisa Indar will speak about, is ramping up testing. Dr. Tedros would have said test, 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 but if you read his release carefully, he said test, 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 but for suspected cases, and we are going to be ramping up that. Dr. Wheeler will speak more about that. We have 4,000 tests coming into the country as a gift from the Chinese. This will come into the country.
Test kits.
Test kits, yes. 4,000 test kits as a gift from the People's Republic of China. They will be here next week for the use in Trinidad and Tobago. We are also getting an additional 15 thermal scanners to help us at our different ports of entry. Other plans we have operationalized in the past 24 to 48 hours is going to be manpower. You are going to now need more manpower. So some doctors at the North Central Regional Health Authority, Eric Williams, especially consultants, SMOs, senior medical officers, and so on, will now be attached to CUVA, because we have made CUVA the focal point for tertiary advanced care for any COVID-19 patients. Now, to do that, you are going to leave a hole or leave a gap in Eric Williams. What we have done, we are going to be hiring more of the junior doctors to work in Eric Williams under the supervision of consultants. That will free up more consultants, senior medical officers to work at Couva. So we'll be backfilling Eric Williams with more junior doctors and not so junior doctors. We have also reached out under the Office of the Deputy Permanent Secretary of Health, Ms. Brenda Jeffers, to start to reach out for retirees, doctors, nurses, any retired healthcare worker in the event that we need them. We are not waiting for the need to go that route because this is an evolving situation. Trinidad and Tobago is part of a global pandemic, and as the Prime Minister and Minister of National Security have been saying, this is evolving all the time. So we have to have plans in place, mitigation risk strategies going forward. So these are some of the plans we have operated in the past 24 to 48 hours. Just to recap, 100 bodies on the ground for contact tracing, 4,000 new test kits coming down. I met with CARFA and PAHO this morning. They will tell you what we agreed upon as far as testing and capacity is concerned. And we are increasing our HR capacity, both at Couva and both at Eric Williams, to deal with this evolving situation and to manage the risk going forward. Thank you very much. So at this point in time, I will invite Dr. Erica Wheeler, country representative for PAHO, to bring you up to date on our talks this morning and where we are. And following that will be Dr. Lisa Indar from CARFA, and we also have Dr. Roshan Parasram, Chief Medical Officer.
Good afternoon, Honorable Prime Minister, Minister of Health, Minister of National Security, colleagues, and members of the press. Thank you, Mr. Minister, for this opportunity to bring the population up to date on our discussions and our support to the Ministry of Health and the government. So, as the Minister said, we met this morning, and one of the key things we were talking about is expanding the diagnostic capacity of testing at the Trinidad Public Health Laboratory for COVID-19. But we're doing this in 3 dimensions. We're looking at equipment, so we will be assessing the lab machines at the 2 sites where there are machines in the country to see if they are compatible with the tests that need to be carried out. If not, PAHO will provide information on suppliers, but we will also be providing supplies for testing, 3,000 tests that would be coming next week from our headquarters in Washington as part of the scaling up of the testing capacity for Trinidad and Tobago. But beyond that, we will also be building capacity of the staff to conduct tests, because once we increase the capacity for testing, we also need to increase the capacity of the staff at the lab for testing. We will do an assessment to ensure that the infrastructure is suitable for COVID-19 testing. And there will be capacity building online. We know that even the U.S. is shutting down, and we will not be allowing, as in keeping with the instructions of the Prime Minister, it will be difficult for non-nationals to come in. So we are being adept, and we will have coaching online, not just of the infrastructure, but also of the staff that will be carrying out the tests. In addition to this, we discuss the modeling of the possibility of increased cases. What will we do in terms of capacity at ICU, capacity in terms of human resources for health? So PAHO has tools for modeling, and we will be in a few days working flat out to assist the Ministry of Health in ensuring that we can give them data on different scenarios for any possible increases. What we want to do is to be absolutely on the spot in terms of community transmission. We don't want to be caught unawares. So between the the capacity to do more testing and also modeling the different scenarios should there be increases, we will be in a better position to help to support and advise the government. So, for example, we are looking at things like hospital readiness checklists and protocols and standard operational procedures. We will be looking at the isolation facilities in ICU. And as the Minister, he already alluded to that the government is looking at the human resources for health needs. So apart from that, we are doing many other policy updates, like, for example, the government already had an influenza preparedness plan, and we are reviewing that with the national COVID team to ensure that the international guidelines by WHO on clinical management and developing algorithms for first contact with the health services will all be in place, as well as training on donning and doffing that we have already started. So we really see this as a partnership and very much in support of the government. We have provided some PPE equipment. We will be getting more PPE equipment. We handed over some of it yesterday because, of course, the safety of health workers is paramount. So, Mr. Minister, I would like to stop there. Thank you very much for the opportunity. Thank you.
Good afternoon, Prime Minister, ministers, members of the media. CAFA also would like to take the opportunity to thank Ministry of Health, Trinidad and Tobago for giving us this chance to speak. So, as of CAFA has widened its capacity to test, and we are now using the new definitions from the WHO guidelines, which now indicates all samples that are meeting suspect or probable cases of COVID-19 will be tested from all CAFA member states. So that is the first thing we would like to let you know. All samples that are meeting the definition for a suspect and a probable case. And this is in accordance with the new definitions for WHO guidelines, which speaks. A suspect case is a patient with severe acute respiratory illness, that is fever, cough, sore throat, and so on. It could be one or more than one of that, and no other etiology, or a history of being to a place where a country where there was confirmed transmission, or a patient with any acute respiratory illness and having been in contact with a confirmed or probable COVID-19 case, or a patient with severe acute respiratory infection, that is fever, and at least one of the other symptoms of respiratory illness, which is cough, shortness of breath, requiring hospitalization, and with no other etiology. So, in general, it is a person who is showing symptoms with etiology, with history of travel to a country that there was transmission, or a person who is showing symptoms and been in contact with the case, or a person who is showing any acute respiratory infection and being in contact with a confirmed case. But they must be showing symptoms. Thank you very much.
Good afternoon, Honorable Prime Minister, Honorable Ministers. Just to give the update in terms of number of cases tested to follow on Dr. Indar's presentation, we have 258 samples being sent to CAFA. Thus far, we still have 9 confirmed positives. I want to just speak a little bit, shift the focus a little bit and speak to the issue of sanitization that my public health inspectors have been doing. So last week, I would have advised my Chief Public Health Inspector to actually hold the hands of the supermarket owners and other people on the ground with all our public health inspectors to ensure that there was decreased risk of transmission in those places. So as you know, the supermarkets are essential and they have to remain open. Any areas where we have food being sold, the markets as well, So they would have gone out in full force to basically tell people how to wash your hands, put up hand sanitizers in the necessary areas are extremely important. Using things like gloves when you come in, disposing of the gloves when you come out are new processes that they have been using as well. And I just want to say sanitization of all hard surfaces is extremely important and has been left out in a lot of places. So it's very important. We have gotten calls from certain associations saying that the PHIs have been a little heavy-handed, telling them how many numbers of people should be in a space. I have gone back to my chief inspector, just making sure that we are not too prescriptive when it comes to public health measures. But the key is we are avoiding congregation and we are avoiding contaminated surfaces. And that's the two principles that we want to stick to. And my public health inspectors, along with the public health inspectors from the regional corporation, will be the ones on the ground ensuring that supermarkets and any other area where people congregate are clean and sanitized as often as possible. Just to give those remarks.
Thank you very much, Dr.